Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes. Welcome to another episode of Food Freedom and Fertility. As always, we are your hosts, Sophia, Pavia, and Caitlin Johnson, both registered dietitian nutritionists who specialize in women's fertility. Me, Sophia, with the extra special specialty of helping women make enough progesterone so that they can get pregnant, stay pregnant, and have a healthy baby. And Caitlin with the specialty of helping women with polycystic ovarian syndrome or PCOS. And today, we are covering a topic that we get asked about so frequently. And I was honestly shocked when I looked back on our catalog of episodes and saw that we have not had an expert on to really talk about this that much.
We've talked about
So
it.
here we are. We've talked about it unendingly, but
It
we
was
have
like
not
we
had,
couldn't find the person.
we haven't had somebody come on to talk about acupuncture. And that is what we have Miss Emily on here today. So welcome, Emily. We're so happy to have you. Would you mind just kind of giving our audience the 2-minute pitch of who you are and how you got here?
Sure. So my name's Emily Marson, and I own Aphrodite Fertility in San Diego. Shout out to San Diego. I actually didn't, yeah, I guess I had missed that you were local, and this is such a great little community that we have going
Yeah.
on here. So I have practiced fertility acupuncture for 8 years, and our real specialty is, of course, Eastern medicine and acupuncture for women who are trying to conceive, but also, as you both do, really walking women through sort of the darkness of infertility and helping them with really clear, non-Googled advice and actionable steps towards getting themselves to their family. And then on top of that, we sprinkle in Eastern medicine and acupuncture. So our mission is really to reach all of those women who are really suffering silently in their fertility journey and walk with them to their family.
That's amazing. And suffering silently is like, that's it. I feel like so many of us lack the community and don't know how to talk about these things. And yet we find them on our feeds or in our offices. And it's nice to have a sense of community with your clinicians, but it's not the same as knowing that people around you are going through this and know what you're going through.
Yeah, I find that it's still obviously very taboo to and vulnerable for women to admit that perhaps something is not going as they had planned in their fertility journey. And we really provide this safe space where we're not part of their friends or family, but we become that for them during this time. So it's a lot of course, medicine, the Eastern medicine and acupuncture, but also developing a relationship with someone who you can trust, who is there to pull you through and who has been really in this community and can give you the advice and also the space to offload a lot of what you're holding deeply sort of compressed inside of you and the worries that you have, and tell them that there is hope and light, and we will. I really honestly, from every core of every single cell, know that we can get you to your family, whether that's with us or in conjunction with Western medicine and other holistic practitioners. Really, the goal is to get you to that family that you've been looking to get to.
When people are like looking for an acupuncturist, I think let's start here because while you're in San Diego and so is Soph, I'm not. And so if I want to access an acupuncturist in my community, what type of credentials or questions would you recommend somebody asks? And maybe even before that, maybe give a little bit of a preview of like what does it take to become a Chinese medicine
Sure.
provider or acupuncturist, however you would also define yourself.
Yeah, so I'm of the generation where acupuncturists were licensed, and now there's a doctorate program that all
Mhm.
acupuncturists go through. It's a 5-year full-time graduate program, and so it's a lot of school. I'm sure you guys know. Um, I think there's a misconception that it's sort of like a certificate, and you go and you learn for a couple of months, but there's really deep-rooted study in not only the medicine, but also the history and the philosophy behind uh, this sort of, I like to call it Eastern medicine pattern identification, because it was really built off of medicine when there were no microscopes. So basically, it's like
Right.
a thousand years of clinical trials, basically, of like an acupuncturist looking at sets of symptoms and then relating those groups of symptoms back to what they were describing going on in the body. And they tended to use words that were similar to nature because they were also observing nature. And so,
Yeah, very agrarian society.
yeah, absolutely. And so they described dysfunction in the body with a lot of words where they would see dysfunction in nature. And so you'll hear terms in acupuncture and Eastern medicine that, like, let's say you have cold entering the body or heat entering
Mhm.
the body, but that now can really be equated to like you have a virus or you have a bacteria infection. It was just that they had the language of nature in front of them versus the microscopic newly
Mhm.
named like Latin words for what was going on medically. um, and so I think that there's hesitancy around Eastern medicine because it's sort of like a language um, difference between Western medicine and Eastern medicine, but they're both describing the same body. It's just as if they're using different languages,
Mhm.
like as if similar to like French and English.
Right.
It's the
Mhm.
same words, except in a different language, and I think that that can be confusing for like a Western
Mind.
patient.
Mhm.
Yeah,
Yeah,
yeah.
when you get described things like, "Oh, well, you have a yin deficiency with excess heat and dampness," and you're like,
What is
"Okay,
that?
what?" Like, I'm
Yeah,
cold and wet. I don't understand what you're telling me." But yeah, that's a really succinct way of putting it. It's like back then is back when Western medicine thought of the body in terms of humors. They thought that there was like different fluids that were like flowing through your body at various times that were causing your body to move and be and live, and it was like blockages in these humors or imbalances in these humors that were causing you to have sicknesses. And it's just a different way of looking at things. And it can seem sort of archaic and foreign. And learning a new language, I mean, it is because these points you learn. I mean, I didn't go to acupuncture school, but I lived with people that were in acupuncture school and they're learning, to June, Jean,
yeah.
Wen
Yeah,
Zhang Tong, Ren one, all these things. Like truly was a new language in all these different Chinese words. But I guess a question I would think of for our audience is, I mean, let's just get down to brass tacks. What
yeah,
is this actually doing? Like, we know what acupuncture is, itty bitty needles poking into your skin at various places. What is this actually doing to us
yeah,
that's
yeah. Okay.
causing a change of some kind?
Yeah, I'll take you through my whole spiel. Okay, so when you rub your hands together, it creates a heat. So movement creates heat. So when you run, you sweat. Most Western women can get behind that. Most Western people can get
Sure.
behind that. So movement creates heat, and your organs move. Okay, so your heart pumps, and your kidneys filter, and your lungs expand and contract. And so there is heat coming off of these organs that's not really accounted for in Western medicine. Sometimes you can think of it as metabolism.
Yeah, your
But
metabolic rate, I guess, would
yep,
be the
totally, totally. But if you want to think, there's movement going on in your organs and it's giving off a heat. And so heat is energy, right? So when you turn on a burner on a stove, it boils water. And so the Chinese observed that the heat, let's say coming off of the heart, moves in certain patterns in your body, just like your blood and your nerves. And so the heart heat comes off of the heart and moves down the inner arm to the pinky. It does follow a lot of the nerve pathways, how they mapped it out. And what can happen, whether the heart itself or its heat pathway can either become like deficient or in excess. You can think of like inflammation, heat excess,
Mhm.
or stagnated. And that can cause the heart itself to function suboptimally or its heat pathway to function suboptimally. So what the needles do is they go along that heat pathway and they mapped out certain points. And just like when you get a bee sting, the body responds. Like when anything
Mhm.
foreign enters the body responds. It sends blood and lymph and more heat. That's why it gets red, like histamine. And so it pushes through, let's say, something, the heat that's stuck, or it brings up something, the heat that is deficient, or it tamps down something that is in excess. So the heat that's in excess. And so the Chinese mapped out where along that pathway you can really adjust and optimize the heat coming off of these organs. And then once you restore that pathway, just like if you were to hit your arm and you get a bruise, that is a blood vessel disruption and the body sweeps it up. Similarly, the needle goes into the heat pathway disruption and reorganizes the sort of optimal function of the organ itself and its heat pathway, creating health.
So I have a question about that.
Yeah,
So
totally.
let's say I came to you and you were looking at, let's just use heart since you've been using that heart, and mine seemed like my energy coming off it was like low or cold. Would that be right? And Sophia's was warm and hot or whatever. The opposite end of the spectrum. Would you treat that with the same points that you put it in? So
Good
you're
question.
you're adjusting the actual placement of the needles based on what energy you're seeing from different systems?
Yeah. So, what deficiencies and what excess we see or stagnation we see, absolutely. Each point does something different. It either like brings up or brings down. We pick different points based on the overall pattern that the patient is presenting to us. And so, how do we know whether your heart heat is in excess? It's the like we started with this conversation, the Chinese have patterned out symptoms. And so heart heat looks like, well, if you think of heat in nature, it always rises, right? And so
Mhm.
excess heart heat shows up as symptoms of heat in the head. And when heat goes to the head, you can think of like flushing of anxiety, right? You literally get red and you have, palpitations. That feels like heat. You have insomnia because you have heat going on at night. And so your brain is active. And let's say you have night sweating when you should be cool at night, your body temperature should go down, but all of a sudden you're flushing with heat. So it's like literal heat signs. That's those are the symptoms that are associated with heart excess heat, and then we pick points that treat heart excess heat. Does that make sense?
So let's flip this to fertility. When you're looking at
Mm,
fertility, are you looking at uterus, ovary, that kind of thing? Or are you looking at
yeah.
like almost like I feel like functional medicine has coined HPO or HPOA access? Like, are you looking at communication pathways between the brain and the ovaries and how they build hormones, and like how does that translate to fertility?
Yeah. So in my clinic, we do a lot of integrative approaches. So absolutely, the majority of women who come in who have fertility problems actually have a cold lower abdomen. Okay, and this can be translated to Western medicine as not enough blood flow to the
Hmm.
uterus, and when you don't have enough blood flow, then you're not pulling the hormones from the brain to the receptor sites. Okay. And so going back to how we use the needles, this is more in the Western sense. I'll go right over the ovaries and I'll put needles in over the ovaries and over the uterus. And that'll just trigger a reaction from the body. And it'll just draw blood there because the body's responding to something foreign. And when you draw blood, you draw the hormones down from the brain. And at the same time, I'm also thinking about their Eastern pattern that's presenting to me. So we go through these signs and symptoms, how your bowel movements are moving, how you're sleeping at night. A lot of questions have to do with the things that have rhythm, that now we know come off of like the
Monthly,
pituitary.
circadian,
Yeah.
like whether
Yeah.
it's
The,
Mm.
daily or monthly or
yeah. Like a lot
Yearly,
of the
seasonally. Yeah.
pituitary, um, what the pituitary is
cadences.
regulating. Yeah.
Mhm.
And so those sets of symptoms, given the Eastern medical differential diagnosis, I will also treat points. And those tend to be like the distal points that we put
Mhm.
in along the hands. The ones directly over the ovaries and uterus, the function is really just to drive blood there, so that you have more of a pull from the hormones coming down from the pituitary and the HPOA axis.
Okay, so I'm gonna flip back a little bit to my kind of first two-part question because I don't think we got there. I've seen an acupuncturist that was like trained in China. I've seen an acupuncturist that probably is from China. I've seen somebody in Wichita who's been doing it for 30 years, have no idea where her training came from. And then all over Wichita, wherever all these people became chiropractors, they also got some sort of certification to do acupuncture. And so it's like the chiropractor is also doing acupuncture. Personally, that seems suspect after seeing like such great practitioners. So, can you kind of like, now that we kind of have a little basis for what it is, if you were looking for an acupuncturist somewhere around the world, I guess, or any other state and city other than San Diego, California, like what would you be looking for, or who would you be asking to find the right referral to somebody who's going to think about it like you're talking about thinking about it? Because I doubt the chiropractor had enough training in just this to be thinking about it in a truly Eastern way.
Yeah, I think that their websites will tell you a lot about how they practice. Like we started, so there is a license, and you want to obviously make sure that they are licensed. And we do go through like 5 years of training. The chiropractors and the physical therapists are now practicing like dry needling, which is
Hmm.
it's literally acupuncture, and it's just a way to get into acupuncture with a different name,
Yeah.
without having to be licensed. And so, yeah, if you're looking for deep Eastern medicine theory, I would go to someone who has been in practice for, I think, at least 5 years. We are not taught fertility medicine in a grad school, and so I would if you're looking for a fertility acupuncturist, I would make sure that they use the language of fertility on their website. So not just like we treat fertility, but also,
Women's health,
like women's
hormones.
health. And also, yeah, like they know AMH, they know what FSH, they know the whole HPO axis. You can see it on their blogs, you can see it in their um the language that they use on their website. Because while I think acupuncturists can come out of school and just use Eastern medicine as the person presents in their symptoms, which is like truly pattern differentiation, where I think we have a lot of success in my practice is we also know the deep Western medicine and how to translate the two. And now I'm using the ideas of Eastern medicine on top of the science of Western medicine. So in Eastern medicine, is there anything about the HPOA axis? No, there's no like direct translation. But knowing what I know about the communication between all of those essential points in fertility, I'm using the needles then to direct the body. So, for example, like the pituitary sits, right at the section of the base of the brain. And so I actually put the needles into behind the ears and direct the body's attention there to pull blood, lymph, histamine, and to activate that pituitary um, more optimally. So it's like combining both Eastern and Western, and that's why we see such huge results. The other thing is I hesitate. Sometimes Eastern and Western medicine sort of pit against each other. So there's
Yeah, no one wins with that.
no one, yeah. And so we just say we're part of the toolbox. And sometimes we find that people who go into acupuncture school have usually had some offense by Western medicine, right? They have
Yes, yes.
discovered, yeah, they have discovered Eastern medicine and acupuncture because Western medicine has failed
Mhm.
them in some way. And so when they
Mm.
come out of school, sometimes they can hold that bias like real close and they can be like, this is the true medicine. And like, we're here to be like, "Oh, the golden age of medicine is when we are all using everything that we have to get you to your family, your healthy baby." And so I would look out for that sort of tone in the website. And when you talk to someone on the phone, is are they open to bringing all the tools to
I
the
love that
table?
point. It's such a good point.
Yeah, or
Yeah,
even just curious versus arrogant and thinking, I know the way to do this versus I know a way to do this.
right.
Yeah, because I mean, come on. Caitlin and I have been practicing what, 10 years, 15 years at max? I can tell you, in the short 10, 15 years I've been practicing, I've been made to look like a total idiot so many times just because you learn more and you learn something different. Or new data comes out that proves that what you were doing was not the best thing. Or even you start doing it for a while and you're like, this is not the best. Like, how much did we focus on weight loss and stuff when we first started working? It was like all we did was help people try to lose weight. What a scam. I mean, honestly, a lot of the things that I was doing that I was recommending, I would never do that now. And so I you can't I'm using this as an example, not that like I'm an idiot or anything. Please know that I don't think that of myself and I hope you don't think that of me, but more just like if even in the past 10 years nutrition practice has changed to where like how much we're pushing people to lose and how quickly and how important we think this is and the methods that we're using to do that we look back on and cringe now. You can't look at the way that you're practicing and think like you are the end all be all of what can happen. And I realize Chinese medicine has quite a jump on what we're doing in Western medicine because I can tell you dietitians don't have a history 1,000 years long. We're pretty new. But still, frequently, you look back on what you were doing and realize there's a better way now. And so you don't want somebody who's going to be arrogant and think they know exactly the right thing
Right.
and shan't be questioned.
Right. Or lead you away from something that might actually help because of their own stuff, right?
Mhm.
Because they
Yeah.
were once hurt by Western medicine. I think that as long as they sound open to using all of the available tools and they have a team of people that they can refer to, we
Mhm.
are constantly in communication with OBGYNs and IVF doctors. And something that's interesting about IVF is that there are now studies that link acupuncture to increased IVF results. And so while the IVF doctors don't know what we're doing, they do know
It's
that
working.
it's working and they have to publish their results publicly. And so they're like, we don't get this. And like many doctors are like, whatever that is, we don't know. But IVF doctors are like, actually, we would love an increase in success rates. So go see whatever like they're doing over there and then come back to me. So it has really like legitimized acupuncture as a tool in fertility in particular, because there are now good studies that increase success rates there.
That's
All
amazing.
right, let's take a quick pause here and hear from one of our sponsors. And then when we get back, I've got another big question for you. Hey, Food Freedom and Fertility family. It's Sophia introducing Fertility Cloud. High treatment costs can be daunting, but here's some good news. 80% of Fertility Cloud patients have gotten pregnant for under $2,000 after just 5 months of treatment. Starting your family doesn't need to come with a huge price tag. Fertility Cloud virtual consultations mean you can talk to them from the comfort of your couch. They create personalized plans for men and women, whether it's ovarian stimulation with Clomid or Letrozole, Ovidrel trigger shots, guidance on male fertility, or even weight management support with medication. As a special for Food Freedom and Fertility listeners, get $50 off your initial medical doctor consultation. With meds delivered in just a day or two, unlimited support for your questions, and free follow ups when needed, they're here to make your path to parenthood smoother and more affordable. Ready to start? Visit myfertilitycloud.com and enter Food Freedom, one word, at checkout. Okay, now for another sort of doozy of a question. Our audience is largely Christian, though we have people from all faiths or no faith that come to this podcast to listen to the information here. And one of the things that I hear being sort of like a point of concern when it comes to acupuncture is there seems to be like an inherent spiritual side of this, that this is almost practiced as like a religion for some folks. I see this in indigenous Chinese people, that like this is not just their medicine, but this is their belief system, this is their spiritual path. And I know of people that are of other faiths that say, look, this is the one faith, the one path, and dabbling in these other things is going to be very harmful to you. So, is it possible, or I don't even really know how to phrase this, but can the sort of medicinal side of acupuncture and these energies, the heat flowing through your body and things like this, does this need to be spiritualized? Is it inherently spiritualized? Like, is that why this works? Or is there something else to it to where this is I'm stumbling over my words here. I know of people that go take a medicine and they have no really weirdness about whether or not they're like sinning against
Yeah, it's
God
like it
by,
has a morality or immorality. Same with
yeah, or they get
Christians with yoga or
Right.
yes,
Ayurvedic medicine. They think all of a sudden once
yes,
I dabble
yes.
into it, I've crossed into something that is
Or I'm potentially harming my relationship with God, myself physically, myself spiritually. Can you sort of just speak to that? I realize that's not like a concise question, but I think you kind of get what I'm asking.
Yeah, I got it. I was actually pretty surprised when we were talking offline about this. And so I did actually a bunch of research because
Oh, thank you.
yeah, I was thrown because because that is has never been how I felt like I practiced, like there was any spirituality in it. It was always medicine, as again, like we talked about, just in a different language than Western
Mhm.
medicine. And so there was never a sense for me that I was manipulating like this spirit or the soul, which is something that
Mhm.
I sort of found in reading up on this context. And so what I would say is that we are not no longer taught that it is of a religious like source. When
Mhm.
we're in school, it was never really like this started as religion and now is medicine. Um, there was a shift to make it to make it for Westerners to make it less sound less spiritual.
Spiritual?
Yeah.
Yeah.
When Mao came into power, and like and the Chinese opened up themselves to Western, he actually took a lot of the language that was like spiritually confusing out of the medicine and made it more like of a Western structure, that so that it was only really now thought of as medicine to legitimize it to the world. And so what I really have to say, I guess, about that is a couple things. We know that acupuncture works whether or not you believe in it, because you can give acupuncture to animals. So like a dog walks in and it's limping, and it has no like real spiritual
Concept. Yeah.
pr-
Hmm.
yeah, practice, and you will needle the dog, and then the dog will get up and walk out of there better. And so it
Hmm.
what didn't take any belief or influence of the spirit on the dog to create a result, just like Western medicine. Okay, so
Yeah.
or nutrition or food, right?
Yeah,
You
you
have
do
a
you hide the pill in the dog's food. It doesn't
yeah,
even know that it's getting its arthritis medicine, but
right.
later on in the day, laughing and not laughing, that would be creepy, but playing and jumping like a puppy and not in arthritis pain. And so the dog
Mhm.
didn't know it was eating the pill, yet it benefited. The dog
Yeah,
doesn't know
just
what this
like
acupuncture is supposed to be doing. It just benefits.
yeah, like I've worked with Muslims, individuals, Christians, atheists, agnostics, and nutrition theory works in all their bodies, right? So
Mhm.
whether it has an origin in something, and I just got to say, from a clinician and a patient perspective, there was a time in my life where I probably wouldn't have practiced yoga or gone and got acupuncture.
Yeah, me too.
Man, my life would be so different if I hadn't been able to incorporate those things. Like both yoga and acupuncture, something as a Christian child, I was told, like, don't dabble in those things, have brought great amounts of relief and support in critical times in my life that, like, had nothing to do with or without my faith. It just, like, when I was pregnant and needed to have a baby and the due date was past and long gone, acupuncture was helpful. When I had that really bad migraine that medicine and nothing else helped for 3 days, and then I went and saw the acupuncturist and he put a needle in my ear, it went away. Like, you, it, I prayed for that thing too. I prayed to have my baby sooner. Acupuncture helped. Like, I think that sometimes there's like this pendulum where we swing one way or the other, or this continuum where it's like something that maybe seemed at one point in your life like so not kosher, not good, not allowed, not right. Once you learn, like,
Dangerous.
yeah, potentially, like you're opening yourself up to demon possession or some bullshit like that.
I know. Caitlin and I grew up in sort of like an evangelical
Cult.
church cult. Mom, if you're listening to this, I'm sorry. I love you. And you taught me so many great things, but that church did turn into a cult. I mean, you have to admit it is now. I mean, it is.
Right.
You got
So
out before it got too crazy. But so, yeah, I mean, taught to be like you're opening some kind of spiritual door and you're going to
pathway, or
have
yeah.
some like dark influences bringing creepy scary things into your life and then like blaming the bad things that happen on the fact that you do yoga or you went to acupuncture or you're I don't even
Like,
know all kinds
whatever.
of
I mean,
stuff.
anything can become its own obsession or idol in your life. So,
Yeah,
we're bringing our own cultural bias and histories into this conversation, obviously, but I don't think that we're alone. And
I
um,
just want the people listening, maybe the Southern Baptist gal who has never even really known anyone who's gone to acupuncture and was raised the same way that all of this is the devil. And I just want her to be able to hear somebody talk about it in a way that she can understand so she can make a more educated decision on whether or not this is going to be a good move while she's trying to get pregnant.
yeah, and I think that I think actually it could be even a great match, because a lot of what we study is describing the body and how we see nature. And I also grew up Christian. We see God in nature. Nature is God, one and
Yeah.
the same. And so it's almost like coming to acupuncture with like the hope within God's sort of like natural laws, right? Like, and influencing, um, having someone work within the nature that is God with full good intention, which is also very much part of God's love, is to be intentional with an open heart. And that's what I see when my patients come in, is like the intention is to get them to this family that God intended for them by using like the language and the description of
His
this
creation.
beautiful body. Yeah,
Mhm.
exactly. His creation. Um, and I feel like almost that it is even more aligned with how God intended human body to be seen than even like the Western medicine description of it.
Mhm.
Like we are
Oh, okay.
nature, right? Like we are nature, and this is how our body flows, just like the nature that I've created all around you works. Your body works in similar ways. And an acupuncture is just part of the tools to work within those natural laws to bless you with the family that you wanted.
I love that.
Okay, so I have another question for you.
Yeah.
I've never really heard anyone talk about this part of it. What are the risks of acupuncture? Because everything has benefits and risks. And I mean, I realize the risk of getting poked with a needle, right? Even though those needles are like extremely tiny, but like, redness, itching, maybe a little bit of blood. I guess perhaps it could get infected if someone is like seriously immunocompromised and not using good hygiene while they're doing acupuncture. But aside from the risk of being poked by a needle in any regard, what are the risks of acupuncture?
Yeah. I mean, it's really hard to say.
A
It's
good
really
nap.
benign.
A
Yeah.
good nap.
A really good nap afterwards.
Don't even. I'm
Yeah.
so tired, guys.
No,
I
you need
can't even.
Emily in your life right now.
Before we started recording, you guys, I was telling them how last night my husband kept me up till 1 a.m, and not in the way that you would hope on a fertility podcast. He kept me up till 1 a.m. He really, for months, has been wanting to watch Interstellar with me. And I finally was like, okay, let's give it a go. And that movie is so long. Don't get me wrong, fantastic story. I'm totally a fan. I loved it. But I am dragging ass. So I broke all my rules and stayed up till 1 a.m. watching a Matthew McConaughey movie. God help
Ugh,
me.
I hate him.
Do you hate him?
I just can't
We had
handle
this
his voice.
conversation.
I
That's
cannot.
right. Remember when we were talking about how there's like some app where you can have like people read you stories, and you're like, one of them is Matthew
The
McConaughey who's
first on
supposedly like
Calm,
reading
the
you?
Calm app, the first
Yeah.
Calm meditation, whatever, is him talking about like space and travel and shit. And I was like, this is
All right, all right, all right. We're gonna take our shirts off and we're gonna go to space.
basically, oh man, he's so, I just can't.
Well, he was great in that movie, but I am tired. So I just wanted to give you
So back to
guys,
acupuncture.
in case you care, back to acupuncture.
But okay,
No,
but
what?
a big risk is a nap, right? Like you're gonna
Yes.
leave probably feeling really good and tired and calm and ready for a nap.
Yeah. And you know what's really interesting now that everyone's wearing these like medical, like biomedical devices. So a lot of patients come in with their aura ring, and you can actually see the data of them dipping into like their deepest REM in when they're on the table in acupuncture. So like a couple of patients have come up to me and be like, look at this data here. I get deeper sleep than I do when I sleep at night in acupuncture. And so um, a benefit of acupuncture is really sinking into that parasympathetic state, rest and digest, which maybe they otherwise can't get into in like the hustle and bustle of every day. Now, what I like to talk about is you don't have to be Zen all the time to get pregnant. There are a lot of very stressed out people who get pregnant, but what you do need is some sort of dip into, whether it's an hour or 15 minutes, into parasympathetic, where then the pituitary can really pulse down the hormones that are involved in, developing out follicles. Um, and so what acupuncture is really good at doing is creating a container, right? Where you can't have your phone. And you really do have to sit in
Thought.
sometimes, yeah, the uncomfortability of quiet and not responding immediately to a
And you
text
can't even
message.
really move. Like when these needles are in, it's hard to even like scratch your nose. Like you have to really lay still.
Yeah, I mean, I don't want to create fear. A lot of people get very nervous about being pinned down to the table, and a
You're
good
not pinned down to the table. This is not, they're not like going through your body and like staking you to the ground like you're a tent. This
yeah.
is just, it just is less comfortable to like move around with a needle in, or maybe it could even depends, because like yeah, I've had needles just fall right out at times too because I was moving around too much. They're not like skewering your muscle meat. It's just very
Your
superficial.
muscle meat.
Yeah. And I would say
I
a good
mean, that's what
acupuncturist
people who
would.
haven't had this done, they don't know.
Mhm.
You know, are you like shish kebabbing me? Is that why this is working? Like when you said you put the needle over the ovary, I could imagine people are hearing this being like, are you sticking a needle like into my belly, through my muscles and into my ovaries? The answer is no to that. It's You're not like having a metal skewer jammed through you. It's not that.
I would say I would actually protect. I would do go the level of the ovaries. The thing that I want to make clear
Yeah,
is
I've
that.
never heard of that. I'm so
Oh
excited to
yeah.
hear more.
Oh yeah. Yeah. If you like tap the organs, they respond really well. This is like really why we are able to change outcomes, and especially in like the IVF context, when like follicles are not coming up and they're trying to give you more medication and they're like pumping you full, and they're just like, go to your acupuncturist and we'll go and we'll just tap the ovaries, and like
It's like
literally.
ovarian drilling. It's like the same
Yeah,
kind of
yeah, yeah. Yep.
idea.
Totally, totally. And the receptors light up, and then you uptake more medication, and then all of a sudden they go back 2 days later, and like their follicle has grown significantly. But the thing that's different, what most people are used to with the term needle, is when they get blood drawn, which is uncomfortable, which is so like
Yeah.
1,000 times bigger than the
Like a
actual.
hollow
Yeah.
tube.
Most people are nervous when they come in for sure about the needles, and then they are really surprised at how little they feel it. Um, and so I say, if there's a point that's spicy, just tell me. Like, no, no big deal. I'll take it out. There's so many points in the body that I can do what I want to do. It doesn't have to be that point if it's uncomfortable. Part of healing is to come out of that fight or flight and be able to really rest their body. And so I always say, like, spicy points, you tell me, no big deal, I'll take them out. But the
Yeah,
majority.
there's more than one way to achieve the goal. It's not like
Skin the cat another way.
yeah, well, because when you're coming into like traditional fertility, it's like here's what we've got: medicine or surgery. Which one do you want? You can have this medicine or that medicine, this dose or that dose. And there's not a
What you
lot of
want. That's why you no have boyfriend.
Caitlin, not on the Chinese medicine
Uh.
podcast. You can't do your Vietnamese nail lady accent right now.
Okay. I so appreciate the fact that you just blew our mind that you actually tap into the ovary.
Yeah.
I I also like I have such fond memories of I've probably seen 5 or 6 different types of truly Chinese medicine type acupuncture providers. And they all do it just kind of like a little bit differently. Some of them like set the needles and let you go on the table as long as they can. Like you got an hour, I'll let you lay there an hour. Some are like it's shorter. That one guy that did the thing in my ear never had anything like that before. I was like, got the worst headache of my life, did 1 point, and it took it away. It was amazing. It was a bigger needle and it hurt like hell, but I appreciated him. But then like the most recent acupuncturist I've seen, like she had this like maternal gentleness to her, like 30 years into this. And I was there to help bring on the labor of my third baby. And like, not only did she place all these things for me, like there were times she'd be like, oh, this one is called this in Chinese medicine. And it basically means this. And there was just like this, like, sweet, loving education that happened, not over the top, not like, let me tell you every fucking thing I ever knew about this. But this one, like, I don't even remember what she said, but in the moment, it like almost brought me to tears that it was like this warm, loving point that somehow had to do with motherhood, had nothing to do with her trying to help, progress to the point of labor soon. But it was just like a sweet thing that even just her telling me she was doing that point warmed my heart. And so I think sometimes we think it's all just the needle or it's all just this, but every provider has their own clinical experience, their own specialty, their own mentors that they worked under and saw great success with different types of thing. The other thing that stands out, other than the one guy with the needle in my ear, I spent more time with my acupuncture providers than almost any other clinician I've ever spent time with in just one visit. And I think that that is something unique to acupuncturists and maybe dietitians,
Yeah,
unless you get somebody
maybe
like
therapists.
they've built their practice around that.
Yeah.
Mhm.
It's, so I can almost see like the manner in which you practice your own character and countenance being a huge part of the healing journey for someone that understands, somebody that's dialed into the fertility piece. And
Yeah.
I can read that in you already, Emily.
Oh, I think that what the Chinese never really got rid of is that the mind and the body are 100% connected. And when Western medicine um, sort of became what it is today, everything has been separated
Specialty.
out, even the specialties, right?
Mhm.
And so what I think people are getting when they go to an acupuncturist besides Eastern medicine is a real look at how their body and their mind are held in one space. They are not separated. And so a lot of the healing happens in the talking to the patient, them offloading. We're like their therapist and their Western advisor, coach, and their Eastern medicine provider all in one. And it's so entwined, and they can feel that authenticity of true full care, that has been really sort of separated and
Yeah, it kind of feels like you're being
departmentalized.
lobbed into your different
Yeah.
parts versus looked at as the whole
Yeah,
person.
and I find that there's like a lot of things that are missed in Western medicine providers, like in terms of the MDs in their specialty. It's like now they're so railed into like the years that they have only studied their one thing that they can't even see outside of the box and the whole web of a human in front of them, that like there's so many things sort of lost in this chasm of different specialties, especially in fertility.
Mhm.
And Sophia, you and I sort of talked about it over voice note, but like there is this real missing part of fertility medicine that you guys and I sort of sit in the time between someone's just trying to conceive and maybe it's taking them a couple months and then being like ushered right into IVF, sort of the long train ride into IVF. And like this holistic approach where there are even diagnostic tools not being used that could maybe group some of these women who otherwise would shuttle off into IVF and get them to their baby without having to go through that long journey and that long expensive journey too. There's a MD missing in that specialty because they have like compartmentalized everything. So
Yeah.
like OBs are so concerned, are so, they're so busy with labor and delivery that they're not looking at fertility. And IVF doctors are so driven to have the person who steps into their office to go all the way through IVF that like there's no one in the middle. And as someone who looks at patterns, even if I wasn't Eastern medicine provider, just looking at this system, there's a big break in the middle. Um, Diagnostic tests that could lead to treatment, that could lead to a positive pregnancy test before the big sort of shuttle into IVF. And I think, I think that that is a disservice to women and couples.
Absolutely. And Sophie and I have a mutual listener slash maybe you could call her a client. She was on the podcast. That's a social worker. And I keep talking to her and being like, we need fertility social workers, somebody that can help advocate. Because one of the three things you just pointed out was the actual Eastern practitioner, a therapist, and then somebody that can help almost as like a contractor, like come
Like a
in.
concierge.
Yeah, come
This
in
is
and
Yeah.
be
what it
like,
needs to be.
"Go
You
talk to
go to
this
the
doctor about
hotel
this, and you go do
and
this." Yes.
yes,
And so
you go
you
and you
play
say, "Well,
that.
my kids are 3 years old and we wanna do these things." And the concierge is like, "Oh, well, you can go here on St. James Place and go over
Yes.
to." Yes, we need, like, fertility
'Cause I
concierge.
think we're all doing that in
Yeah.
addition to our
Mhm.
specialty, but having somebody that's, like, in this
That is their
space,
specialty,
yeah,
yeah.
it is a huge gap that's missing, and we're all trying to, like, kind of cover in and help. Hey, friends, we're taking a break from this episode so I can share with you a little more about one of our sponsors, Fullwell. Fullwell's a reproductive health company offering superior nutritional supplements that are made without compromise to support women and men throughout their reproductive journey. I have taken Fullwell's prenatals, their fish oil, and have literally tried every product they've released, and I stand behind this recommendation with my whole heart. One of my favorite things to recommend to clients is their fertility trio. This includes their egg and sperm quality supplement, their women's prenatal, and fish oil. This helps proactively support you getting ready to conceive. This trio includes things like CoQ10, ashwagandha, and NAC. It makes me think of a life vest. You don't want to go into pregnancy without these foundational supports. And if you've been struggling while trying to conceive, this is the time to upgrade your prenatal fertility game and check out Fullwell. Use code FFF20 today to get 20% off your first order. And I think too, our training is very nutrition based, but we look at the whole body system, right? And we can pull labs and go, we need to love on your thyroid, or we need to love on your metabolism and your blood sugar, or we need to love
Your
on
immune
these
system. Yeah.
nutrient deficiencies. Like we can zoom out and kind of look at things that impact the whole system, right? But even still, there has to be this kind of overlap in effectiveness. And what do you do in this in between? Sometimes when you're waiting, or that's not accessible to you for one reason or another. And so the person that's like listening to this going, I have endometriosis, I have PCOS, I'm anovulatory and I don't know why. We've been told we have unexplained infertility and IVF is the next thing. Like, what type of messaging would you give to those different buckets of people?
Yeah, I would say one thing that acupuncture does and does really fantastically is gets you to cycle and you to ovulate. That is really quite easy to treat, and I honestly think it's really rooted at the just creating the communication and the body's attention, pulling blood to the
Mm,
pituitary and to the ovaries like directly. We're tapping on the ovary, like we're waking things up and pulling blood there. We can get someone who is anovulatory to ovulate, whether that's through PCOS or hypothalamic amenorrhea or however it shows up.
Mhm.
um, and then endo is definitely harder. But besides acupuncture, so if there's like a physical block with endo, sometimes we can go in and literally the needle will
Break
create
up
the
a little
space.
fascia. Mhm.
Yeah, exactly. And then we use an herb called moxa, which is this is another thing that you'll want to ask your acupuncturist in order to know whether you are using someone who knows what they're doing in fertility is if they use moxa. It's an herb that usually comes in like a charcoal form, but what they find is that it burns at a really high heat, so it penetrates past the dermal level when you get it close to the skin. And they have found that it is really anti-inflammatory. So especially for endo patients who have this sort of autoimmune component and inflammation component, their acupuncturist should be doing a ton of acupuncture, or excuse me, of moxa on them
On the
to
needle itself, is that what you're
no,
saying?
so you can put it on the needle. We use one that's sort of like a charcoal like stick that we light, and then we sort of stay over the lower abdomen with it for 5 or 10 minutes, and then we give it to a patient to do at home. And that we just had a patient who broke through like high BCL6 levels and got pregnant just from and stayed pregnant. She had recurrent
BCL6,
miscarriage.
that's like, just for the listener, that's like high immune response in the uterus. It can usually it's like adenomyosis or I don't know. basically like a uterine lining. Your uterine lining it's really pissed.
Yeah, it's like a marker for, yeah, endo or adenomyosis. And it just tells you, like, we suspect that this is
Mhm.
causing the inflammation.
So
That
you're
is,
saying we could do something like that before we go do an exploratory surgery to
yeah,
just diagnose you?
totally.
Mind
Yes.
blowing, and a treatment
Yeah.
that probably costs a fraction of your copay, maybe even
Yeah.
anymore.
Absolutely. Yep. And I mean, it does take consistency. And so that's why we teach patients how to use it at home, and that then they need to come. Your hormones change every week, so you need to come home so we can influence each sort of phase of your cycle. But yeah, there is a lot in this space that we can do, and it's not just sort of like woo woo, like we're doing this sort of magic stuff. Like, they're starting to see now, they've done a functional MRI with acupuncture needles, and there's like a point on the leg that the 1,000-year-old text, it says it like brightens the eye, is sort of the words that they use. And they did a functional MRI, which means they can see the brain change when they put the needle into this point on the foot, and it lights up the part of the brain that controls the eyes. So, like, while we don't know specifically at the biomechanical level how acupuncture works, we know that it works. And so, knowing that, and then tapping on the ovaries and the uterus and using this moxa to decrease inflammation. This is really like the Western um, uh, fill for that we're sort of looking for between just trying to conceive, having maybe a diagnosis, and then sort of like being guardrailed into IVF. Like, there are things to do, and I would absolutely encourage, and I'm like, please come see us. We can get you to this baby. Like, you don't have to leap if you're not ready. And there's a time and a place for that if you are ready. But like, we're here, and we have tools that have been around for 1,000 years. So please, like, please come in. We're ready to help you.
I think Sophia and I can relate to that in the sense that, like, honestly, if working on nutrition isn't the thing that helps you get pregnant, it's certainly going to help you in your pregnancy and growing this human you've desired and you want to care for and have the healthiest life possible. Like, there really is very low risk, which is what Sophia was trying to get at earlier. Like, come on,
Yeah.
talk to me about because we're always looking at like benefits, risks, alternatives. What if we do nothing? What is the cost of this? Is this time, money, investment? Like, what is these things when you're weighing out decisions? And whether you work with nutrition to help you achieve pregnancy more quickly or more healthfully or avoid as much of a risk of pregnancy loss, et cetera, like there are benefits to it. I would argue the same thing for acupuncture. Like I have had acupuncture in some of the most stressful times in my life. And because they were a practitioner that was treating the whole human and not just my body, and because they used tools that both helped me tap into more nervous system regulation and restorative kind of modes of my body, but also because it kind of is this like more relaxing and resetting thing in general. Like I would argue there's very low risk. There's pretty like guaranteed gains, whether it's the heavy lift of getting you pregnant for sure, or because there's nothing that will get you that, honestly, not even IVF. Or just it helps you along
Especially
the
not
way.
IVF.
It reduces the time, or maybe it helps you produce more progesterone after you do ovulate. Like there isn't a major downside other than time invested and money invested. But I would argue that those are minimal compared to a lot of the other things people hardly blink at when they're talking about fertility investments.
That's a great way to put it. Yeah.
What can someone expect as far as, I realize everyone has their own like rates and everything like that. So that's maybe not exactly what I'm talking about, but we've sort of tiptoed around this in this episode. It's clear that acupuncture isn't something you just go do like ovulation induction medication and a trigger shot. You like go do this thing, and it's like the one thing you do that cycle, sort of a one and done thing. That this is ongoing care, that this takes several sessions. I mean, what can someone expect as far as like how many sessions they may need, the general cost per session that you've seen in your profession as sort of typical cost, just so people can understand sort of what they're looking at if they want to start doing this.
Yeah, we see the most success if someone comes every week because your hormones change every week, right? So, like your
Okay.
FSH is coming up, your estrogen, then your LH and your progesterone. So, you can think of it as, there's four hormones. We want to influence all four of them. And so, what
Got
we
it.
do is we have patients come every week. I don't think if you have a good acupuncturist, I don't think you need to be coming more than once a week. Some acupuncturists would disagree, but I think if you really know how to influence the hormones, once a week is where we see the most success. And then infertility, as I'm sure you guys know, egg recruitment happens about 90 days before
Yeah.
that one of those dominant follicles ovulates. And so we have this really sweet spot after 4 cycles where we have been influencing maybe the blood flow and the hormone communication while the egg is pulling apart its chromosomes, as it's being prepared to ovulate in that 90-day period. So we've been influencing, an optimized body function with the needles for that long. And then the fourth cycle, we have this like increase of success in acupuncture. So increase in pregnancy rates in the fourth cycle. Um, of course, there are more complex cases. PCOS tends to take longer. Getting the clearing sort of the inflammation from the insulin and its influence on the body for PCOS and getting the cycle to regulate. And then endo, again, also depends on what kind of endo or tissue sort of
Where it is,
growth.
how
Yeah.
prolific it is. Yeah.
Yeah. Those cases tend to take longer. But the general cost in at least Southern California is there's usually an initial consultation. They'll take you through your whole history, and that is a little bit higher cost. It's for us, it's like 225. We've seen it 250, three
It takes a
hundred,
lot more
and then
time. So
yeah,
that
it's
makes
just
sense.
time. It's just the
Mhm.
time. Yeah. And then each session we are 115, and I'd say we're about average. There are, as different generations come out of school, it seems like everyone's charging more. So we
Well,
are
when
of
they're
the
making people go to school that much,
yeah,
then they have to come out of there with $120,000 in
yeah,
debt minimum or whatever.
yeah.
Yeah, you probably are charging $150 an hour because you need to eat.
Right. Yeah. And it does cost about 120, and most people come out with debt. And it's
Man,
five
did I
years of
hit that
school.
nail on the head or
Yeah, you
what?
did.
That was pretty good. That was my husband would have been really proud when he loves to guess a number, that guy. And so that was
So
You
and
won.
so this next session is less. What's the time commitment difference? Not for your sake necessarily, but like, are they coming in for a half hour appointment, an hour appointment? What does that look like?
It's usually an hour. Yep, because there's about 15 minutes of
Setting it
talking. How
up.
you doing?
Mhm.
Yeah, what symptoms? And then it's about 45 minutes on the table with the needles. They see that like blood flow changes in response to the needles in about 20 minutes. So I would say the shortest amount of time I would advise people to be with the needles in is 20 minutes, but we do like a full 45 because we also do moxa and we do some
Mhm.
stomach massage to move the
Mhm.
tissue around and stuff
I
like
love
that.
that.
Yeah.
So I have 2 questions. One being, even at 115, which seems very reasonable to me in such a high cost of living space, but even at that, some people are gonna say that would be a stretch for me. But I found an acupuncturist that will do community acupuncture, and maybe that's a third of the cost. Like, what would you say to that person in the context of all your fertility knowledge? Are they gonna get enough out of that maybe twice a month that they could get the more intensive treatment the other 2 times, or what does that look like?
Yeah, that's exactly what I say. I say what matters is that you're getting touched by the needles weekly, influencing the hormones weekly. But the community acupuncturists are usually not specialists. it doesn't matter as long as the body is responding in some way to blood flow, we're going to
Mhm.
influence hormones. So what I have patients who can't afford it, they'll usually come around cycle day 10, depending on when they ovulate, like a couple days before they ovulate, to give them that really big blast of um,
Pituitary
uh,
support. Mhm.
exactly, from my knowledge base. And then the other three appointments, they'll go to
To
a
like more
community
of a community.
acupuncturist. Yep.
And
Hmm.
the one community acupuncture guy that I went to, I mean, he did all of it, right? And you got a really big discount if you came to his Tai Chi class before the community acupuncture because he was just so invested in people. I loved this guy, man. He was the
Totally.
best. He was in California.
Was he the ear needler guy?
No, the ear needler guy, different guy. First guy I found in Wichita, not my guy. But he helped me that one time. That was great. But this, I mean, this was a great provider. And one thing I loved about him, he's like, hey, if you come to community acupuncture and you're willing to bear it, like if you're willing to show your midriff, and I'm sure he would have poked my ovary if I wanted that. But but I don't have to show any extra skin for you to get to the points that you pointed to right below the ear, so like
Yeah.
sometimes if you're willing to show your belly in a community acupuncture setting, because what that is, at least in my experience, is the practitioner is treating a number of people. You're not maybe on the table necessarily, right?
You're
And
in a like a
Hmm.
lazy boy chair in
yeah,
a room
something
full of
Yeah.
like
other
that.
Yep.
people in lazy
Yeah.
boy chairs.
Yeah. And so like you got to be willing to do that, but it can bring the price down if price is something that you're sensitive to or your only objection. Like maybe go get that first really thorough treatment once a month. You budget for this other one around day 10 and then supplement where you can with the community acupuncture. Okay, that was one side of my question, which I'm not even sure I asked you one.
Yeah. I would absolutely think that's a great treatment plan for where cost is a hindrance.
So the other question that I have is on the side of herbs and teas, and some acupuncturists are like very into this and others are not. And it
Some have dried snakes in a jar in
yes.
their office.
And it's like, and they go and they do their little, like, I'm crushing this, I'm doing that. And then others use this brand that seems to have all those things done for you
Yeah, or
already.
little BBs that you give you in a bottle.
And
Hmm.
very often it's like, man, couldn't look at that on the internet and understand what it is. And this is one maybe area of exception that I have. Like, usually I'm like, if it says proprietary and you have no idea what the heck is in it, don't take it. But like in the Chinese medicine world, I'm suspect of taking something like that because I kind of blindly trust it because it just seems ancient and woo woo, and I don't speak Chinese
And it's written in words I can't
or
understand.
even sometimes Google. So, like, can you
Hmm.
speak to that a little bit?
Yeah, totally. Yeah, I think what really stands out is that it's been around for 1,000 years, right? And so it
Mhm.
has the really, so there's classical herbal formulas. These are the ones that you're getting like online, and they have, we study them in a classical text, and they are a subset of just the same herbs, and it gives you a set of symptoms and you're like, this will help. There's a particular one, it's called Xiaoyao San, and it's basically, if you were to translate, it's like free and easy wanderer. So it's for basically anxiety, to bring down anxiety. And they're just really potent because they wouldn't be around if they didn't work.
Mm-hmm.
And so sort of blindly trusting it, I think is fine. um, and then there's the practitioners who do custom herbs, which is what you're talking about when you're like,
Mm-hmm.
they're like
Be
grinding.
like,
Jar
go drink
Eh,
snakes.
this tea, honey, was the first lady I
yeah,
saw. And I was like, this tastes horrible, but I'm trusting
You
you.
yeah.
wish it was a tea. They would send me home with a bag of dried
Powder.
things. Maybe no, it was not a
No,
powder.
mine was
It was
powdered.
like things,
Yeah,
like
like wood
like little
chips.
bat
Yeah.
wings and like a piece of a gourd and like all this stuff. And you would like do a decoction. There was like a special teapot that you
Mm.
put it in and it got
Hmm.
it to a certain temperature and then you poured it out and then you poured more water in
I
and
feel
you
like
let
you
it
went
sit
to
and
the
then
real Chinese lady.
you mixed the two together and then you poured it in your jars for the week.
Yeah.
It was bad.
Yeah, and right, and I think like especially in the Western world, like with herbs, compliance matters. Like taking it regularly is how you get results. And I think having to do all of that stuff that you just described, Sophia, is like will keep you from doing it
Dude, you're like, "I
regularly.
just went and got a gas station burrito, like, I didn't even put this much effort into what I'm eating today."
Right. So I
I've been
think
wearing the same pair of yoga pants for 3 days, and you want me to, like, wash and dry these herbs every night? I don't know.
totally. So convenience is a big part of the success of herbs. And so getting these ones that are in tinctures is yeah, I think
Tinctures, capsules, would that be
capsules.
okay?
Yeah, yep,
Powders that you
totally.
mix or those little BBs. You know what I'm talking
Yeah.
about? They're like pills
I
that look
don't
like little BBs.
I don't love the BBs. I don't think that they're as potent as the herbs that are set in like a little alcohol dropper. I think because the
Yeah.
the tinctures that are in alcohol opens the blood vessels, and so actually you get more of a response when you take
Mm.
the tincture, yeah,
Oh, that's
than
good to know.
the BBs, yeah.
And it's
Um,
a listeners, it's a tiny amount of
Yeah.
alcohol because I know
oh
that
yeah,
we've
trace,
jumped on alcohol plenty on this podcast, and
totally.
we've also
As
celebrated
we've
it plenty on this
sipped,
podcast too.
as Sophie and I just spent a
Yeah.
week together drinking
Like,
wine every
"Listen, this
night.
is not good for you."
Do what I say, not what I do.
But I was up till 1 AM
Uh,
watching Interstellar, and I need a drink.
Emily, you
Yeah.
are a gem. I wish I lived in San Diego so I could just come
I
see
wanna
you.
come get a treatment from you. Come
Oh my gosh,
poke
please.
this fibroid,
Yeah, I
shove a
got you.
needle into it,
Yeah.
stir it about,
Yeah, yeah, I
break
got
it
you.
apart.
We'll go right into it. Yeah, yeah. Come on in. We would love to have you.
Oh, I
Seriously.
love that.
Oh
Emily,
my gosh. Okay, I have one question. I have one more question. I know that we're,
Yeah.
like, going too long in this
Emily, this is
episode.
my question. Look at my tongue.
Yeah, how about this?
Oh, okay. Oh, yeah, yeah.
Mine's
Yeah.
green from my
They do,
smoothie I
they
just
look at your
drank.
tongue and tell you if
And
what
my
they think
pulse
about it.
is
Yeah,
Okay.
so your
Well,
pulse,
let
your
me
tongue.
try to explain that in a
Okay,
Western
okay.
sense too. Okay. So quickly. So the tongue is a muscle. It's tissue, right? And so we
Mhm.
look at the tongue to look at the state of the tissue in your body. Okay. So like the tongue's
Mm.
tissue will represent the state of the tissue in your body. And so it has certain characteristics that we look for, these things that we call like heat and what you call like dampness. But let's just say we can say like inflammation or overgrowth of bacteria. We're looking at the tissue, and then we can assume that that is happening in all of your tissue,
Oh, interesting.
including the ones that are linked to reproduction. And so we treat
We
based
saw
off of
that
that.
with the holistic dentist that we had on here.
Mhm.
She said much the same thing
I
about, like,
feel a little
various
violated
things in your
about
mouth.
that though. Like, I'm sorry, I'm pretty into everything and will get naked in front of almost anyone, but as soon as you look at my oral health and you're drawing a conclusion systemically upon it, I'm all of a sudden very nervous.
Hmm. No, it's just like,
Interesting.
yeah.
I'm just
I
saying, like, it's an interesting thing. Every time my Chinese medicine practitioner looks at my tongue, I'm like, "What do you see?"
Don't tell me. Give it to me straight. No, I can't handle it.
I think that I think that your tongue looks beautiful, first of all. You have a nice
Ah,
tongue.
I've always said that.
And if you maybe you get to think of it as it's just a one of the tools on how we
I know.
pinpoint.
I know it in my
Yeah.
head. I just am like, "Ooh, but don't did I brush
Okay,
right?"
can I ask you my
Yeah,
ridiculous
okay, go.
Yeah,
question?
do.
Sorry.
Because I just people ask this,
Mhm.
and can acupuncture influence whether or not you're gonna have a boy or a girl?
Oh, no.
Thank
No.
you.
Thank you.
Definitely not. We're not
Shout it
magicians.
from the rooftops.
Yeah.
Okay.
Yeah. We are not magicians. And
Well,
so
people think this because 'cause they're like,
I
"Look at
know.
China, it's all boys." And I'm like, "You don't wanna know what happened to the
Right.
girls,
Right.
okay? Unless it's
Exactly.
the acupuncture."
Yeah. I would say that's a hard no. It's a
Ugh.
hard no. Yeah.
This is
We
Yeah,
can't
terrible.
well,
we
it's just
can't
truth.
yeah, we can't um change DNA.
Good
Okay,
call.
we can have the
What?
body
Get off this
respond.
podcast. What
we
a
can help
fraud.
we can help the body work as it should, as it was designed to, but we cannot change an XY to an XX or
We are gonna
etc.
take a break from this episode and chat a little bit about one of our sponsors. Truth be told, when we were contacted by Fond to see if they could sponsor our Food Freedom Fertility podcast, it kind of was like one of those dream come true sponsorships. Let me explain why. There are very few foundational foods that cover broad nutrient needs for fertility, gut health, and baby's brain development like fond is. And not only do they create these foundational foods, they kind of exceed in every category that I can think of what we want to put into our bodies. They're the only verified regenerative through land to market bone broth, tallow, and lard on the market. Unparalleled animal sourcing, all pasture raised, or 100% grass fed and finished cattle. All the herbs and vegetables that are in the blends and the seasonings of these broths and lard are exclusively organic. Nothing is packaged in plastic. The entire packaging process is plastic free from kitchen to their shipping materials. When I think about this regenerative fat line that they've just introduced to the market, I use it in so many different ways. I've used their pork lard that's flavored with cinnamon and vanilla when I've been sauteing apples to put in my children's oatmeal. I've used their regenerative beef tallow that's flavored with chili and garlic as I've sauteed meat that's going to go into a slow cooked pho style dish. And then I've used their broth within that dish itself. I love the flavor combinations. I love that I can trust that these foods that I'm putting in my body are so clean but truly delicious. The infused flavors are ready to sip, and all the fun flavors can be used to take any dish from good to gourmet. I've been using these for the last 4 or 5 months every single day and have seen a huge difference in my own health. And I know this is our fertility podcast, but we started taking on Fond as a sponsor at the same exact time that my dad got diagnosed with esophageal cancer. And I had so much peace in these moments where he could hardly eat anything, that he was sipping on a bone broth that had so much gelatin and collagen and amino acids that I knew we were reducing inflammation in his body and giving him just these beautiful, naturally occurring electrolytes and protein that was so easy to get down. This is one of my most favorite products I've ever used in my kitchen. And I am so proud that we get to partner with Fond. Fond has generously given us a coupon code for their website where you can receive 10% off. So that's FFF10. Or if you click on the link in our show notes, it actually brings you to a landing page where the discount is baked right in, and some of Sophia's and my favorite products are hanging out on that page for you to peruse. Please give this brand a try. Please support them. If you haven't listened to our episode, you are just gonna scream at how incredible this brand is and what they've come through, supporting a woman founded business that has your health and our planet's best interest at heart. It's something that I can't be more proud that we get to partner with, and they sponsor you getting this free fertility information straight to your phone every single week. Now back to our episode. So, okay, this is maybe, I don't even know how to preface this. I'm just going to say it. Infertility is a really hard space to work in. Emotions are high, like on
Yeah.
both ends of the spectrum. When your patient gets pregnant, it's the greatest day of celebration if they haven't had a million losses before it, in which it can be a day of great anxiety, which I highly recommend. If that's you, go see Emily or another provider just like her. The wins are really huge wins. Like, looking at a wall of babies that I've been a part of their story, and there's nothing more compelling or exciting to me about getting up and going to work every day, and I feel privileged to work in this space. But there are days where I wake up and it's a hard roll because that person you've been working with for 6 months got her period again and not a pregnancy positive. Had a miscarriage, spent all this money on IVF, and has nothing to say for it other than a really large amount of debt. And so, Emily, you're in this space willingly. This is apparently a choice you've made to kind of specialize in
We
this
don't see a gun
area.
to your head, so we're assuming this was voluntary.
I want to hear a little bit, like maybe as we kind of wrap this episode up, why are you here in this space? Like, why is this community really important to you specifically?
Oh, I don't know. I think like doing women's work is just in my root. It's just like there really is there's you know women have
You're a girl's
and
girl.
I am, and I have two boys at home. I have, my husband and two boys at home. So I'm like, oh, God must have given me this space because I have to like balance out
If you could
the
see her
masculine
right
and
now, she has a
She's
hot
so
pink
beautiful. Yeah.
peplum
So
top on with
feminine.
these like poofing sleeves, a
Go
coral
to YouTube. She's
lipstick,
beautiful.
these chandelier earrings. There's
yeah,
flowers behind her in her
yeah,
picture.
yeah. I mean, my space is really feminine because I think there's healing in that as well. But anyways, like I am just made to do women's work, and I think that women over the course of history just have suffered, and I'm here to tell them that they are not alone. And there's really nothing better than helping women, especially women. Like I'm talking, of course, we're talking about couples, but women carry the burden of infertility absolutely. And their spouses can do only so much and only understand so much. Like I see a lot of the male partners just they're like, oh yeah, yeah, we'll get there, we'll get there, it's fine, we're gonna get there. But then the woman has to see their period every month. There's like a physical
They
disappointment as
feel
well as a
it.
mental
Yeah.
Feel it,
disappointment.
yeah.
And there's so much heaviness to that. And I am here to carry some of that. Like,
I love that.
yeah,
Be a real one.
women really deserve, they do so much, and they deserve, to be held for a moment in a really difficult time.
Yeah. I love that. Well, how can people find you?
Yeah, all of our handles and our website is aphroditefertility.com or Aphrodite Fertility are all our at handles. Yeah.
Cool.
And what
And
part
we
of
we
town are you in?
yeah, we're in Bankers Hill,
Oh,
right
okay.
across from the park. And it's a beautiful space. Again, it's meant to be non-medical, and it's also, in a lot of Eastern medicine, aesthetic is very much the same, and this is more like, come walk into this warm sort of living room feminine space and
I'm
be
Mm.
held
huffing
held
at
by it.
like Eastern medicine
Yeah.
vibe. Thinking of like a old woven tapestry with like a
Ugh,
dragon on it
It's
in
all
black and
stinky
red
for
dude,
some
with
it's the
reason.
golden
worst.
fringe with a cat waving like this.
Yeah, totally. It
A
is. And
fog
so I think that's
at a
also
gate, some
what makes us
oranges and shit.
different. Totally. Because part of the very intentional way I brand is to step out of that and bring you into sort of like a really warm feminine environment, which also allows for healing.
Oh my
My
gosh.
branding is very intentional. Yeah.
Oh, I'm looking at your website. I'm
Okay,
loving
well,
it.
listen, I'm going to schedule with you and I'll make
Amazing.
like a
Do.
reel about it or something
Please
and
do.
we
We'd
can
love to
come
have you.
there.
Yeah.
Get it
On the house. Come
going.
on in. Yeah. We'd love
What?
to have you.
Oh,
Yeah,
I'll
yeah,
I
fly
yeah.
to
don't
San
care. I'm
Diego for
just thinking
that.
in
Yeah,
my
Give
come
mind,
me
on,
an
please.
how
excuse.
do I
Please,
convince my
please,
husband to
really.
let me pay for this?
No, on the
Oh,
house. On the house. Yeah.
All
oh,
right, shish kebab this fibroid. I can't wait to get my
I got it.
ovaries poked
Yeah. Yeah. I've been
in
following
a
your story.
non-sexual
Yeah.
way.
you only let one
Okay.
person do that.
Yeah,
Yeah.
I only get one person poking on these ovaries in the other way. Oh God. Okay, please. I'm delirious.
Save us.
Let's
Yeah,
get
girls.
let's get to the yeah girls. Okay, I got a big one.
Go.
You ready for
Do
this?
it.
So I went and saw my surgeon yesterday, the one that did my endometriosis excision as well as the ectopic. And we looked at my MRI results and they look so good. So, this fibroid, we've never looked at it through an MRI before. We've done ultrasound, and my sonographer is bomb diggity. He's so good. He estimated that it was like subserosal, but as far as like how far into the muscle tissue did it go, and was it also sort of protruding into the endometrium, or like you've got different layers of tissue in your uterus, and which one is it in, and how big is it, and all of that. Um, but this is the first time I had an MRI done to show very clearly like where exactly it is within the uterine tissue. And it is about half of it is like hanging off the side of the uterus. My uterus looks like a pear. Like there's like the actual uterus part and then this big, like an upside down pear, like a big, you have a pear, like the little skinny neck and then like the big round body. The big round body is the fibroid and the little skinny neck, like is the uterus. So this fibroid has shrunk. It's only like 3 or 4 centimeters now, which is like a ping pong ball. And it does not protrude into the endometrium, which is likely why I've been able to have 2 babies without incident. So it's very operable. I would not have to have a C-section after having the surgery, as was previously thought. So this opened up a whole nother window of decisions about, do we want to get this removed and then try to have another baby? Do we want to have a baby and then have this removed? Like, how do we want to go? So we still have to make those decisions. But it was very encouraging
Mhm.
and felt like quite a victory that
Oh,
like these
yeah.
things that I'm doing. I mean, I have to preface that we've done an episode about how I'm taking like new medications now to shrink this fibroid. The MRI data that we went over was done before I started these
Oh, that's
medications.
cool.
So
So
we
you can do
can't,
a post one and compare them and
I'm
see.
going to do a post one.
Mm.
Cool.
Exactly. I'm going to have another MRI done. And I'm remembering now that I forgot to say that to my doctor to order me another MRI.
Do it when we hang up, messenger.
But I'll have to call her and ask her to do that. So,
Yeah, girl.
anywho,
Yeah, girl.
yeah, girl, the fibroid is not as angry as she once was. And I think that she's gone from enemy to frenemy, I would say. I've been calling her my frenemy for years. And so this gave me a lot of hope. And I'm like, maybe a little too hopeful. I'm like, dude, maybe I pitch these meds and we just give it a go this cycle and see what happens, you know? But
Yeah.
that's probably foolish. I just am thinking it feels like everything's possible now. And that's my yeah, girl.
Isn't hope just amazing how it can turn something so hard, like all of a sudden you have a new license on life? Because I feel like that's what
I
you
love
got
that.
today. You got a lot of hope
Yeah,
handed to
I
you.
agree.
Yeah.
Go get
And
it shish
yeah, I've,
kebabbed, do your course of medicine,
yeah,
repeat
Yeah.
your MRI, and then let's get it on. Let's see what the next step is.
get it on. Yeah,
That's really
okay. Thank
exciting.
you. Yeah, girl.
Yeah.
It is exciting. Thank you
Yeah.
very much.
Emily,
Yeah.
do you have one?
Yeah. I now, been doing this 8 years, and I just had a patient who came back for her third Aphrodite baby, and she's now pregnant with
Ooh.
her third. So all three of her children have been um born sort of under our care, and it's just like, wait, like it's so amazing to create families. I have like the best job in the entire world.
You do.
And
We feel the
I
same
do.
way.
Yeah,
The
yeah,
heights
yeah,
of it are the best. The valleys
yeah.
are really fucking
Are
hard, but
tough.
the
Are
heights of
tough.
it are like it's a mountaintop experience. You leave
It
work
really is.
feeling so
Yeah,
good. Yeah,
yeah,
girl. 3
yeah,
babies?
Yeah, girl.
yeah,
So
yeah,
cool.
yeah.
So where is she at? She's trying to conceive. She just found out she's pregnant. She had the baby.
No, yeah, she just found out she's pregnant
Oh,
for her third with us, and so it's been incredible because she came to us. She was one of probably my first patients in my first year, who had come after a couple losses, and
mm,
then
Mm.
we got her pregnant, and then she came back for her second, and back for her third, and here we are,
I love
creating a
that.
whole family. Yeah.
I just called you Emily. What do you like your patients to call you? Are you Dr. Emily? Are you
No, no,
Emily?
no.
Your
Yeah, just
last
Emily. Just
name?
like, yeah, like I'm here to be a friend too. So
Mhm.
let's keep it at that casual, yeah, girl level.
Hey, it's me again, Sophia Pavia, registered dietitian nutritionist specializing in women's health, fertility, and optimal progesterone production. And I'm interrupting an episode of my own podcast to tell you about my online course called Ovulation Unlocked. So, if you've been listening to our podcast episodes, you've probably heard a lot of things about basal body temperature, cervical mucus, cervical position, and tracking your fertility. Well, I have designed a 90-minute self-paced online course, which I titled Ovulation Unlocked, that puts all of that together and teaches you how to be the expert on your own fertility from home. This course is designed to put you in the driver's seat of your own fertility, not only so you can know what's going on with your body on any given day, but so that if you need medical help, you can show up to the appointment informed and ready to communicate. Too frequently, us women show up to our doctor's appointments and just say something like, I want to have a baby. And the doctor looks at you and says, good for you. Stop using birth control, start taking a prenatal, come back in a year if you're not pregnant. And that's all we get. However, Ovulation Unlocked puts you in the driver's seat, puts you in control of your fertility to where if you need help, you can show up to that appointment informed and ready to communicate your needs. So if you want to become the expert on your own body and your own fertility, head on over to my Instagram bio and tap the Ovulation Unlocked link today.
Okay.
Let's hear your yeah girl, Caitlin.
Ooh, I was just struggling to think of what to say. I
How's your
think
dad doing?
he's doing okay.
Okay, that's not a yeah girl.
No, it's not a yeah girl. It's like I just got back from vacation with Soph. I left for a week. He's on tube feeds. He has cancer of the
Cancer recovery.
esophagus. Yeah. And so we had a pretty major surgery recently. But he is having less regurgitation. It's just progressing. His diet is happening a lot slower than he expected, and he's discouraged. So that has kind of painted my vision of it. So if
Not
you're
being able to
listening to
eat, that
this,
is
maybe
a
it's not
major
a yeah
bummer.
girl, but you can keep praying with me for my dad, Pat.
I love that.
In
Done.
recovery.
Will do.
But kind of what was coming to mind, so I'm just going to say it, is that, you know, we're switching into summer mode here. My two girls that went to school every day of the week, today was Fiona's last day of first grade. And I'm just kind of looking to the summer as a sweet time to have a little bit more face-to-face time with my kids and trying to really intentionally adjust our days so that I can get enough work in. But then when I am done with work, I can just be with my family and not, I have a really hard time turning off the entrepreneurial brain that I have. And so that feels really good. And kind of in that vein, we have this huge family reunion for one of my husband's, like one side of his family, which is huge. And there's like a thing on Sunday and a thing Saturday night. And like during the day, Saturday, a bunch of the cousins that are coming to town were looking for a place to get together. And I had originally been like, oh, just come to our house. And they all messaged this week to be like, is that our plan? And I was like, it can't be our plan. I have too much on my plate and it's painful for me to say this to you, but we can't host. We might come, we can't host. Let's find a park or something. And I don't say no enough. I just take so much on my plate, and that
is the truth.
It was a big deal to just be like, this is not in my bandwidth, even though I want it to be. I want to just party with you all, but I can't. And
Good for you.
I don't know. They
Yeah,
were also
it's hard to
gracious
say
about
no to
it.
things that are fun,
It is, but they
even
were
when
so
it's for your own
gracious.
health.
And or my
Yeah.
family's health, or like just the day going easier. It's okay if we all meet at a
Totally.
park and not at my house, just because I have a house that could handle it, you know? And
Yes, you don't have to have a bathroom that 15 people have run through every hour.
exactly. I just can't
Mhm.
handle that right now. We have too much going on. And so saying no, that was a big deal for me. And just to like shout out to other moms, they were also gracious. Like, yeah, say no. It's okay. We'll find another place to be. And they were so loving and gracious about it. It just felt like I need to get better at doing that. I just need to say no more.
Yeah.
Yeah, gracious no's with other suggestions. Like, I tell you what, here are my like top 5 parks in the area since none of you guys live here. Special emphasis on this one for the shade trees. Could one of you run through Jersey Mike's and get some subs and sodas and like we'll just party down at
Yeah,
the
well, I'll
playground?
Venmo you or whatever. Yeah. So,
Uh-huh.
yeah, girl. Yeah,
Yeah.
Saturday, Caitlin. You're going to be so much happier. And you know what? I
Yeah.
shut that door and then something else also came up. My sister-in-law is coming into town and today's her birthday. And so my mother-in-law was like, I want to host just our family since it's a big family weekend, just our family for lunch to celebrate her. And I was like, well, couldn't have said yes to that if I had kept this other plan. So, you know, it's just like that
Yeah,
saying that no opened up something else that I think is probably more intentionally aligned with what we need to do.
And you know what I feel
I
like?
love it.
I feel like men can often do this better than women is like even saying no without having to explain why. And like maybe just like leaning into just being like, um,
This can't work
well,
anymore.
yeah, this doesn't work and I'm like,
You
I'll
just need
see
to
you
spend more
at.
time with my daughter, Jenny. She says no with no expectations
Wait,
or
where do we lose that?
explanations.
Right? Whereas we as women feel like we have to explain ourselves somewhere along the road from toddlerhood on, right? We as women
Mhm.
feel like we have to explain ourselves away
When we
and
get
give
told that
me
we can't say no, that we don't have a
right,
voice or a
right,
choice. I mean, if you always shut down their no's, then you're basically telling them you don't have that option.
totally.
Instead of helping them come to realize, like, you're right, my choice wasn't a good choice, like helping them move through that versus I've been doing that with my 3-year-old lately. He just doesn't prefer my mom. And so he'll be like, she'll walk in and he'll be like, doesn't even use words anymore. And I'm like, Grandma Mary has a heart. When you do that, you hurt her heart. It's okay to not want to hang out with her right now, but you could say, I want time with my mommy alone, please. And because that's really what you're saying. You're not saying I don't love you. I just, when you come in, mommy doesn't pay attention to me, right?
Right.
So I gave him those words the other day. And this morning, he said to my mom, I want mommy time alone. And just pointed. And I was like, you know what? It's an improvement. It has nothing to do with grandma. You just want your own mommy alone. And I'll take it. It's a step in the right direction. There are your words. Oh, it's a good point. This was
There
such
you
a good
go.
episode. Emily,
This
can we
was
Yeah.
have you back sometime and like we maybe
Yeah,
choose a condition and you tell us more?
totally.
Or maybe we role play, like since you're going to treat Sophia in person, maybe we do like what an intake looks like with me and just talk about
endometriosis and
things.
fibroids. Yeah.
Yeah,
Yeah,
or, like I
absolutely.
think that could be really interesting for people.
How
Yeah.
damp is my uterus? I don't even know if those things are dampness. I'm pretty sure the fibroid is.
Yeah, it depends. Depends on the other symptoms. Yeah.
Let us pretend
All right.
we have
Yeah.
expertise in something that it took her
Yeah.
5 years to
I'm
learn.
just making it up,
Yeah.
guys. This is
Yeah.
not real. I don't know about this. Okay. Well, thank you so much, Emily. Thank you,
Yeah.
listener. Rate, review, subscribe. Go find Emily at Aphrodite Wellness Acupuncture.
Fertility. Aphrodite fertility.
AphroditeFertility.com.
You got it.
All
Yeah.
right. Catch us on the next episode.